In the desolate corners of our world, millions flee from war, persecution, and climate catastrophe. Today, over 100 million people are forcibly displaced globally, the highest number in recorded history. Welcome to the unseen reality of refugee camps, where survival itself is a daily battle. Refugee camps are not just temporary shelters, they're breeding grounds for disease and despair. In the infamous Moria camp on Lesbos, Greece, 20,000 refugees crowded into facilities designed for 3,000. Outbreaks of cholera, tuberculosis, and measles are common. The WHO reports that refugees face mortality rates 3 times higher than their host countries. Consider the Syrian refugee crisis. In 2016, a child in Zaatari camp died every 3 days from treatable conditions: pneumonia, diarrhea, preventable infections. Medical supplies were scarce, specialists non-existent, and hope fading. But amid this darkness, a ray of hope emerges. Telehealth is revolutionizing care in the most impossible circumstances. Imagine a refugee child with severe malnutrition, connected via satellite to a pediatrician in Berlin. A pregnant woman in a Bangladeshi camp receiving ultrasound guidance from a specialist in Oslo. During the Rohingya crisis, when 700,000 fled Myanmar in 2017, the International Rescue Committee implemented telehealth in Cox's Bazar camps. They conducted 15,000 remote consultations in the first year alone, reducing maternal mortality by 27%. In Lebanon's Syrian refugee settlements, where 80% lack access to proper healthcare, telehealth platforms like Global Good Health have connected 30,000 patients with specialists. One remarkable case: a refugee woman with a rare heart condition received life-saving surgery after diagnosis through a virtual consultation. The numbers speak volumes. UNHCR reports telehealth has increased access to specialist care by 40% in refugee settings. In Kenya's Dadaab camp, remote mental health services reduced severe depression rates among refugees by 35%. Yet challenges remain. Limited internet connectivity plagues many camps. Cultural barriers and language differences complicate diagnoses. And funding remains inconsistent despite proven success. But the potential is undeniable. The World Bank estimates that scaling telehealth in refugee settings could save $1.2 billion annually while improving outcomes for millions. It's not just about medical care, it's about restoring dignity, hope, and the fundamental right to health. In the wilderness of displacement, telehealth builds bridges to humanity. It transforms deserts of despair into oases of possibility. As our world faces unprecedented displacement, this technology isn't just innovative, it's essential. The future of refugee healthcare isn't just connected, it's compassionate.